If you want to know what's going on in Rockingham County government, check out Rockingham County 411. If you're interested in county governmental programs, projects, and services, don't miss Rockingham County 411. Public Information Officer Mabel Scott will share important, crucial news you can use with Rockingham County 411.
Rockingham County 411, you're in a good place. And today we are talking with Jeff Pruett, and he is going to give us an update on opioids in Rockingham County. First, tell us your official title now.
I'm the Opioid Resource Safety Coordinator for Rockingham County. I'm a contract employee with the county to work with our opioid epidemic.
Okay, and in that role, tell us about your mission and what your goals are, what you're trying to do.
Well, the mission is to, one, we want to get as much education out into the community as possible because we do have a stigma issue.
Yes.
And stigma is a huge problem. And with education, we can improve on that. We need more resources in our county. We need more feedback from folks in the county on what we need to do. We need more knowledge, more knowledge, more knowledge. We need to get people into those treatment resources so that we can overcome the problem that we have with the epidemic. But we also need the prevention in place so we can prevent this with our generations coming up. Because that's a big issue, because we have our children seeing their parents and now grandparents also,
yes,
that are having a problem with opioids.
Yeah.
And we're not just talking about, illicit drugs here. And I really need folks to understand that. Because the first thing you think of is you think of the heroin, and you're hearing fentanyl, and you're hearing those two terms a lot, and I definitely like to talk a little bit about those today. But we're also talking about the prescription medications that have been prescribed to folks for many, many years.
Yes.
It's been at least a 30-year problem. And we've been really researching and doing a lot of work with it for the past 20 years on prescribing practices. And I do not want folks going out there beating up our medical personnel. Because remember, once upon a time when you go into the doctor, and this is still done some, one of the things they ask you is, tell me from 1 to 10, what is your pain level?
They always do that.
What is your pain level? Now, we shouldn't be doing that so much anymore, unless it is someone who's definitely working with chronic pain, or someone who happens to be, let's say, a cancer patient for one thing, that you're really trying to control pain with. But for the everyday individual that's going in, it may not be something that you need to know, because people manipulated the system. Let's just put it that way. So, and you were expected as a physician to prescribe what is needed to control the pain. And I want everybody to know that these potent painkillers were really meant for folks who were at end of life, or cancer patients, or other diseases that were end of life, to help keep the pain under control and maintain dignity. Think about it. We all, maybe I'm getting at that age now. You start thinking about that a little bit of, when I get to a certain age and, something happens, what do I want to do? And I want to maintain dignity as much as possible. So, that's, and I think that, that's really the intention with our physicians, but it did get out of control. It got out of control. And then we tried to reel it in, and then we had, some physicians out there, it's like, I'm just not going to prescribe it all. Or we started sending people to pain clinics, and people figured out, a way of getting the medications. And then the prescription medications all of a sudden were starting to be sold on the streets. They started getting street value. And you started seeing, 10 milligrams of this, 5 milligrams of this, and it was sold by the milligram. And depending on the good old basic economics of supply and demand, that also controlled the price. The heroin / fentanyl problem come in with that, because it was seen that America has an opioid problem. So instead of cocaine, it turned into opiates, turned into the heroin, into fentanyl. Fentanyl is a very powerful drug. And so the illegal fentanyl that's coming in from overseas a lot of it through the southern border, and it's getting into our communities. And I like to tell people, if you're really interested and you really want to get a good feel of how this started, read the book Dreamland. And it really is a great job, a great reporter. Went in, done his homework, got out in the field with folks, and even went down into Mexico to learn how this was being brought into America and how it was being distributed. It's a great book, a great read if you're really interested on how this happened. If you're talking about reducing stigma, I think that would help a lot.
Now think about this whole opioids epidemic, and then add to that the COVID-19 pandemic.
Yeah, we added to our problem. Well, let me rephrase that.
That's huge.
COVID added to the problem.
Yes, yes.
Our numbers have went up. You know, that's something that saddens me. You know, I've got a military background.
Mm-hmm.
All the years at war, we were seeing soldiers starting to misuse these medications. Mm-hmm. And we started working with programs in the Army, and after I got out of the Army, I just took it into the civilian market. And now seeing this, what do? We lock people in their house. Some are around people that, not the best people to be around. We got our kids around us, grandkids around us. A lot of things being seen, a lot of things being done. It did not stop the distribution of the drug. People were still able to get the illegal drug. Now, you know, there's ways of that happening that I'm hearing out there that people are being creative on this happening. But people aren't reaching out. And I'm not saying they don't want to. They don't know how in a COVID world to reach out when you can't go into a facility to get treatment. And the facilities are trying desperately and doing a very good job of trying to set up teletreatment. Does Rockingham County have good internet everywhere? No.
We just talked with the chief information officer
Right.
about that, Derek Southern.
Right,
Yes.
and that's the thing that, you know, there's an area where we're hurting, where, you know, you don't have the greatest internet in the world, and you're trying to set up doing teletreatment or phone treatment with someone. And, you know, in a situation like this, face-to-face treatment, you really got to have it. Sometimes
Yes.
group, sometimes individual, and sometimes, you know, what works for the individual. But you got to be able to see that person. You got to be able to reach out to that person and to be able to touch that person. Many reasons. One, that's what they need. We got to show them that we care. Some of this seems a little cold when you're doing things by phone or over a computer. And not everyone is computer literate to be able to do this. It actually takes someone to help educate doing this. And when you can't get out to them and you can't touch that person and you can't help them, and they may not even have the device that they need, it sets us back. And I'm hearing that from our treatment providers, not just in Rockingham County, but in, you know, counties surrounding us and in other states. As I talk to folks who do something similar to what I do, it's not just Rockingham County that the numbers are going up. The numbers are going up nationwide. I mean, 2018, you know, we had over 60,000 people die of overdose. The numbers were very compatible for 2019, and I don't even know that we have the accurate numbers in. In 2020, I really don't know if I want to see those numbers. But, you know, with the addiction, it really rewires the brain, and it does become a medical issue to go along with it. Think about it. This is something that needs treatment. So we've got to be able to offer more opportunities to our folks in Rockingham County and continue to do the prevention to keep this from happening to the next generation. Hey, I'm a grandfather. You know, I definitely would like to see this taken care of before my grandkids get up in those teenage years.
Tell us about the Fall Opioid Symposium.
Well, this was supposed to be a spring opioid symposium, but we all know what happened in the spring.
COVID just changed
And
everything.
it was going to be an in-person training. We were going to set it up. The community college was behind us, and we were going to use their auditorium. And we were really going towards something that was, you know, we were really going to be proud of for Rockingham County. Good speakers, half-day training to be able to reach out to the community and give them good information. Well, we're still going to do that. It's going to be virtual, and now we're going to record it. I didn't know how I felt about that at first, but I'm going to be honest, as we've got more into this, and thanks to Insight, North Carolina Technical Prevention Technical Assistance, these guys that I've worked with in other avenues in the past, and I've reached out to them and I said, oh, hey, all this stuff we're doing, and you guys do great recordings and great trainings statewide. I need help. And Jamie and his group, the first thing out of his mouth is, sure, what do you need? And I said, here's the idea I've got, and this is what I'd like to do. And we've been working with it for the past probably 3 months of how to put this together. We've started recording. We're going to have a virtual symposium. We're still going to talk about stigma, talk about prevention, treatment, recovery, and we definitely want to give an avenue for the community to have input on this, because we want to know what the community needs, thinks. To some extent, we definitely want to know what you think. We don't want to know what you need. If it's more education, if it's more specific education, we know we need treatment. We know we need inpatient treatment. We know we need detox. These are the things that are out there. If someone needs to go through detox in this county right now, they got to go outside the county.
Winston-Salem?
Well, Lexington, possibly
okay.
Winston-Salem, and other, and even farther out. That's not necessarily a bad thing, because it gets you out of your environment for a while. I'm not saying it's a bad thing, but not everyone has access to it. So if we had something, we could work with more here, and we know that. And these are the things and the information that we need, so that we know how to move forward with this in the future. Yes, we're going to continue to do education. Yes, we're going to continue to do prevention. And the good thing with this is now we can get this out over the internet. We can give it to our schools, our businesses, our churches. It can get out to the community, our civic organizations. There's many, many outlets that we can get this out. And we're cutting it down to an hour and a half so that we're not losing people. Instead of a half-day training, where you do a lot of interacting. Well,
their attention span.
Yeah, we're not going to be out there, shaking hands and meeting people necessarily now, but we're still going to have great speakers put in place. We're going to have treatment organizations that are in Rockingham County talking about what they're doing, how to get involved with them, what their treatment process is, and how to work yourself into recovery. Insight's going to do some great prevention stuff. We're going to talk about stigma. We're going to try to educate the community the best we can. And then we do want that input, and we want to be able to come back and revisit this in the spring to see where we are.
Okay. Post-overdose response team.
If you hear PORT, that's the acronym. This is a great opportunity for Rockingham County. When we started our task force back in the spring, one of the things I brought up to everyone was I would like to see this in Rockingham County. I kind of have a Superman complex when I think about things. I want to make giant leaps. I know you can't do that.
Put on your cape and let's start from
with a military background. I really, I'm looking a year down the road, and then it's the baby steps of how to get there.
Yeah.
Really, that's the way I'm looking at it. But this is the big picture. But Chief Hassel at Reidsville already had this in his head. He already wanted to do this, and he was sitting at the table, and he brought it to the table. So he's the one that said Reidsville wants to do this first. So we put a team of folks together, we sit down and talk about it. And what is it? It's an opportunity to, when law enforcement EMS in Reidsville right now, because that's the area that we're starting this in, when they have an overdose, this gives us an opportunity for a treatment provider, a peer support specialist, and this is someone who is in recovery, and other experts in the field, usually a team of 3 or 4,
providing that support
for the person. And we want to catch up and meet with that person within a 48 to 72 hour period. The worst time really to try to get with someone is immediately after the overdose and after they've been revived. Of course, they're going to be offered the opportunity to go to the hospital and options from there. Most people, unfortunately, are not going to take that opportunity. So we want to come back to them later, and be able to say, okay, you've had a little time here. We want to talk to you. We're not here to arrest you. We're not here to do anything
Blame.
yeah, we're not here to
No.
do anything but to reach out. We care about you. We want to give you the opportunity to help yourself. Now, with that, it means we got to listen. Because in a lot of people's mind, and when I'm talking to people in the community, and I even catch myself doing this from time to time, I think that the thing that what we're definitely looking at here is the addiction. And that's the first thing we need to be working with. And that's not necessarily true, because remember, when you got someone who's suffering from substance use disorder, get used to that term, folks. Substance use disorder is that we want to hear, where are they? Their immediate need might be food, housing, transportation.
You're talking about basics.
Right. Maslow's hierarchy, right? That might be the first thing that they're looking at. They're not even thinking about the addiction as the first thing that needs to be taken care of, because for us out here, and me as a layman out there, you think, well, you take care of the addiction issue, everything else falls into place. And that's not true. That's not true. But if the person's coming to you saying, look, I really need food, or, I need a roof over my head. If that's what they need, and if that's what they're reaching out for right now, we want to be able to offer that to them, or the opportunity to go there, so that we're showing not only are we here to help you, we're also here to listen to you.
I love it.
And this is a great opportunity to reach out to the individuals in the community and say, show that we do care about you. We do care.
You care, and you're bringing a comprehensive team and a comprehensive approach to help them.
Yeah. Now, I'm going to let everybody know there is a law enforcement officer with this team. They're in plain clothes. I say this for a reason. One, you need to know they're there, but you need to know why they're there. They're not necessarily going in when the team is talking to the individual. They're there for safety purposes, not just for the team, but also for the individual that's there. It's for safety purposes only. And this is the chief's program. This is something he wanted to start. And we got at the table and started talking about that. It kind of took that first 1,000 pounds off my shoulders of, hey, I've got somebody here that already wants to do this and knows what they're talking about. So did we get started in the time frame we wanted to? No, it got pushed back a little bit, COVID, but only about a month or so. It started July 1st. Right now, as of the last phone call, which was a couple of weeks ago, the team has seen 10 people in Reedsville area.
That's good.
Think about
That's good.
And out of that, from what I understand, we've had 3 that's reached out. That's 30%. I'll take that. I'd like it to be 100, of course, but I'll take 30%.
We're going to slowly move and do what we need to do.
But we're not just meeting with them once. They're following up with them. So Daymart and the Integrated Care, who are our 2 teams that are going out right now, and they're taking turns, taking weeks, that are doing this, then, we know right now we got 2 very competent teams that are going out there doing this. And we've got other providers who've come and said, we want to be part of this too.
Good.
From other parts of the county.
Great.
Now, as I said, we want to take this county-wide. It's going to be a little slower.
And we'll hear more about that in one of our next shows.
Absolutely, because
So-
I'll talk all day if you let me.
So we want to thank you for giving us an update of what's going on with opioids here in Rockingham County. Thank you so much, and we appreciate all the support that we're getting from different collaborators, everybody all coming together, forming a big team, and all putting on that cape to say, we're going to be superheroes to go in and help and work and help each other.
Right, and
We
We're
are
gonna
our
continue to
brothers
do
and
so.
sisters keepers.
and I appreciate the county taking the opportunity and making the
Yes.
effort to do this.
Thank you. Thank you so much. Rockingham County 411, you're in a good place, and we're all in this together.